There may be someone in your life who's been to the dentist and had a life-changing experience. Dr. Chuck from here in Central Florida has amazing stories of patients that he's worked on, and it's changed their lives. I mean, drastically. I can't wait to get into those stories. We want to start off, though, if you have had dental care and it's changed your life, we want to hear from you. We want to know about those stories. Can you start with contact information, how people can get a hold of you to share them?
Sure. You can reach us at AMA, which is Ask Me Anything, at the Dental Medical Convergence.org. And ask any question. We'll try and answer it on that. But it's amazing the changed lives that we see with people. People think about smiles and how that's going to change your life. Right. And it does.
Yeah.
I mean, believe me, a great smile, it opens many doors.
But it's cosmetic.
It's cosmetic. The medical aspect of your dental health is what we're talking about right now, is how much the bacteria in your mouth get into your bloodstream and affect the rest of your body.
Heart attacks?
Heart attacks.
Cancer? Diabetes?
Heart attacks, strokes,
Okay.
diabetic complications,
Okay.
pregnancy complications, rheumatoid arthritis complications, pneumonia, now they're finding oral bacteria in the brains of Alzheimer's patients.
All from the mouth bacteria.
Oral bacteria, all. They've dissected the blood clots that have caused either heart attacks or strokes, and they've identified the bacteria that are in these blood clots. And it's amazing how much of the bacteria comes from the mouth. It's a combination between, is it from the gums or from the teeth? And both of them get in there. The ones from the teeth affect more heart attacks, and the ones from the gums affect more cardiovascular disease. That's what it seems to be. Yeah.
Wow.
But they both affect it. So
clearly, if people are getting this bacteria, they're getting their mouths cleaned up, it's affecting the rest of their body. And you have some amazing stories. Would you mind sharing them?
I've had a few stories on this. One of them, we'll talk about Alice. She was on dialysis. She was she was not in good shape. She had been seeing doctors for many years, and her medications weren't working good. They were having trouble getting the bleeding stopped when they unhooked her from dialysis. She had absolutely no energy. Things were not going good for her, and she had been seeing dentists on a regular basis. Physicians on a regular basis, not seeing dentists. She hadn't seen a dentist for years because nothing hurt. Finally, she had a toothache. She came in, we looked in her mouth. Suzanne, you didn't have to be a dentist to look in her mouth and go, oh my gosh, what's going on? It was a disaster,
Really?
A total disaster.
Okay.
We had to remove all of her teeth except we were able to save 2. That's how bad things were in the mouth. Okay? Now remember, she's been seeing a physician on a regular basis for years. Nobody has looked in her mouth. The treatment was to remove all of those teeth except for 2, made her an upper denture and a lower partial, got that taken care of. Within 3 weeks of getting these bad teeth out, so the treatment was antibiotics and then remove the bad teeth. Okay. Within 3 weeks of just doing that, they weren't having any more trouble with the bleeding when they unhooked her from dialysis. Her medications were working better. She had energy. She had pep in her step. She was an artist. She hadn't wanted to draw for 2 years. Now she's back doing those things.
Gosh.
Why? Just removing the infections that were going on inside of her mouth. And again, this is what bothers me. She's been seeing physicians on a regular basis, and nobody is looking at the mouth. And I don't really blame the physicians, because they weren't trained to examine the mouth. They were trained, the dentist has the mouth covered, don't worry about it. But the challenge is the blood going through the mouth picks up bacteria from any infections, and it brings that bacteria to the whole body. When you replace a heart valve, why did it go bad? A lot of times just full of oral bacteria. You look at some of the other problems we have, and you trace it right back to the mouth. And I've heard the saying so many times, things are hiding right out in the open. Okay? The answer is right under your nose.
Yeah, literally.
I mean, literally right under your nose. Yeah.
Dr. Chuck, I'm going to ask for you to share one more story, because it's one that you spoke about on your TED Talk, and it just is profound. It just blows you away, about the woman with the boil.
Oh.
Would you mind sharing that?
Sure, happy to. No, this was a gal, she had an abscess on her thigh. Pus was coming out, didn't look good, couldn't take care of it. Went to the doctor. They put her on antibiotics, it went away, and it came right back. They put her on antibiotics a second time. It went away, and it came right back. Third time, they decided to culture it and find out, where's this coming from? They were oral bacteria.
Coming out of her leg.
In her leg. There's oral bacteria coming out there. So she hadn't seen a dentist for years because nothing hurt. Everything's fine, right?
Right.
3 abscess teeth. 3 big abscess teeth. We went in there. We took care of the abscesses. We got her on antibiotics, removed some bad teeth, root canals, whatever it took to get her healthy.
Wow.
And
It still amazes me every time I
her
hear
her abscess went away. Her thigh got better. I mean, so can something from here come out on your leg? Absolutely. But my question is, if it was bad enough to come out of her leg, what damage has been done to the heart?
Yes.
What damage has been done to the brain? What's already taken place on there?
Mm-hmm.
So this is the front door to our body. And that's the thing we need to have is a clean and healthy front door, and we can avoid so many of these medical issues that we don't want to go through.
I have a feeling there's someone watching this right now going, yes, I have a story. I have to share it. One more time, Dr. Chuck, how can they get a hold of you and share their story about
We'd love to hear your stories.
having your mouth cleaned up or having a medical issue that just reversed because you took care of your mouth.
Took care of the source of the infection, not just treat the symptom.
Right.
But took care of the source. And another story.
Yeah, please.
Okay.
Oh, yes.
New patient, the only medication she was on was for high blood pressure. She went to the doctor, they took her blood pressure, it was high, they gave her a pill, the blood pressure came down, everything was
Treated
okay,
the
right?
symptom.
Treated the symptom. We did an exam on her. She had a big old abscess in a lower left molar. I'll never forget it. No pain. Didn't have it. This is people have a hard time understanding there's no pain.
Okay.
So anyway, we took care of the abscess. She came back in 3 weeks and said, guess what? I don't need my blood pressure medication anymore. Can a dental infection raise your blood pressure? An infection anywhere in your body can raise your blood pressure. Your body is trying to fight this infection off. Okay. But what's the side effects of the blood pressure medication? Dry mouth. Well, when you have a dry mouth, now you don't have the saliva to dilute the acids that are being produced from the bacteria, so your cavity rate goes up and your gum disease rate goes up. So by only treating the symptom and not looking for the source, the physician who did what he was taught only made the situation worse. So this is why we need to include the mouth when we're evaluating someone's health.
Because that bacteria is going through your whole body.
So, but if you have a story, I'd love to hear it, and we'll share that. Just send it to ama@thedentalmedicalconvergence.org. We'd love to hear your story and share it with other people. Nothing helps people understand than stories. You know, that it really illustrates that, that makes sense.
Yeah, and Dr. Chuck had 3 amazing stories today. Would you share this video? Let people know it might not be you that's having medical problems, but maybe a family member or someone, a friend, and you can't exactly, maybe it's not so easy to say, hey, when's the last time you've been to the dentist? But you can share this video and let Dr. Chuck share this information.
Well, many times you'll have family members taking care of someone who's sick.
Right.
And they don't know why this person is sick. They've been to the doctor, they've done this, all kinds of things, and they still can't figure out what's going on. Consider getting a dental examination, a thorough dental examination, to at least find out, are there infections in there that could be getting into the bloodstream and affecting the whole body?
It's good stuff.
Yeah.
Like and share. Thank you so much for joining us.
Thank you.